Hello and welcome. Today the topic is both multiple sclerosis and parasites. They both cause brain lesions. Today we're going to talk about research. I'm going to show you that there are multiple different types of parasites that cause lesions in the central nervous system, in the brain, and in the spinal cord that resemble the lesions found in the central nervous system of MS patients. And this is huge because it really helps us to understand what's causing these lesions. And then we will be having different types of treatments, and there is the wonderful possibility of recovery. If we haven't met, my name is Pam Bartha. I'm the author of Become a Wellness Champion and the founder of Live Disease Free. I was diagnosed with multiple sclerosis over 36 years now ago. And when I was first diagnosed, I was told that your immune system is attacking your nerve tissue for no reason. There is no cure. There are certain immunosuppressive drugs that we can use to try to slow down the immune system, try to slow down the progression. But they assured me that as experts, there was nothing that I could do to change the course of my life, that I would be completely disabled in time. I was devastated. I thought I was a healthy person. And then all of a sudden, I had this mysterious thing taking over my body. So, by the grace of God, by crying out to God a lot, I found, or my mother-in-law gave me a book on integrative health. And they were talking in that book, written by a medical doctor, talking about how infections, chronic infections in the body were causing MS and other diseases, and how, as this doctor treated those infections, people were recovering from all kinds of conditions, including multiple sclerosis. So when I read that first book, I didn't know if I'd be cured. I just thought, this is a lot more hopeful than what I have been told by the experts. So I decided to take a different path, and I never went down the standard of care for multiple sclerosis again. I have lived 35 years or 36 years by now, MS free. I had another child. He now has 3 children. He's married. I have 8 grandchildren. I was able to raise my family. Now I'm a grandmother. I actually got back into horses again. Been married to my soulmate for over 40 years. And I would have never had this life, and especially the privilege, the honor to coach others in their recovery, because when you get your health and your life back, that's what you want to do. You want to help others. And that's what I have been doing for over 20 years now. So since then, we have served thousands of people all over the world, helping them to recover from many types of chronic diseases, including multiple sclerosis, but others also, stemming from infections, stemming from parasitic infections in the body that our doctors don't have good tests for. They haven't been trained to identify or to treat these parasites. And so people are left just stranded, basically. And a lot of people are starting to understand that they're dealing with parasites, and they're desperately trying to find answers. They're self-medicating. That is not a wise thing to do. But this is why it is so important to share this information, so that, number one, you see that when they're saying, oh, we don't know why you have lesions in the central nervous system, it's just a sign of multiple sclerosis. It's a sign of inflammation, but we really don't know what's causing it. It's your immune system. Your immune system is overreacting. It's gone haywire for some reason. No, the science shows that there are some very common parasites that cause lesions in the central nervous system. And so there is a true cause of these lesions. And as we treat these parasites, then our brain can heal, we can prevent future lesions, and our body can heal, and we can recover, we can get our health and life back, and we can live a long, healthy, and happy life, learning from this horrible ordeal that we've gone through. So the way that we diagnose multiple sclerosis is through MRIs. So that's an image. It's a technology where they use very strong magnets that take pictures of our brain and our spinal cord. That's what we're looking at with multiple sclerosis. And they see these little white spots in our central nervous system. And those white spots are lesions. So the lesions show up as white spots in the central nervous system. So they don't know what causes it. They just know that they're present in specific parts of the brain of MS and in the spinal cord. So it's a very, very powerful magnet, and radio waves also that capture detailed images of our brain and spinal cord. And so again, we don't know what causes the lesions, but this technology is able to find lesions in the central nervous system if they're there. And so lesions are pockets of inflammation. They are pockets of damaged tissue where the immune system is fighting something. Yes, it is an immune-mediated condition, MS, and all autoimmune diseases, and even cancer. So the immune system is always involved, but we can have different types of parasites that are in MS or cancer. There will be certain ones that are similar in different diseases, but there will be some that are characteristic to specific diseases. These lesions are present in not just multiple sclerosis also, that's really important. They are present in different conditions like migraine headaches, lupus, Parkinson's, Alzheimer's disease, brain tumors, strokes, inflammatory bowel disease, and encephalomyelitis. And also, I've heard also in the research, like people that are dealing with autism, they can have lesions in the central nervous system. So this is not an exhaustive list, but you'll see that other conditions have lesions too. It's not only characteristic to MS. Another thing to mention too is that they keep changing the goalposts. So they're like, okay, years and years ago, it's like, okay, if it's an MS patient, they have lesions in these specific parts of the brain. And then later, they're like, well, no, it could include these other areas. And then later, well, no, it could be in this area, and this area too. So they keep changing their criteria for where these lesions should be present with multiple sclerosis. So these lesions are pockets of inflammation. There's a war going on, a war between our immune system, and it's fighting some kind of enemy. And they just don't know what the enemy is. They're just saying, oh, it's just gone haywire and it's attacking your own tissue. So there are various parasites that have been documented in science that they cause lesions in the body, but also in the central nervous system. And we're going to talk about the central nervous system today because that is a big factor of how we diagnose multiple sclerosis. So the first parasite I wanted to talk about is Toxoplasma, and this is a type of protozoa. It's a single-celled parasite. It has much more complex physiology than a bacteria, but it is a single-cell parasite. And we can get toxoplasmosis from eating undercooked meat, also from produce or contaminated water or produce, exposure from our cat feces. So if we have a cat in the house and we're cleaning the kitty litter box, cats do carry this protozoa, and we can become infected from our pets, from our cats. And also occasionally mothers can pass this on to the developing baby in utero. The lesion pattern, so this is what's known in science, is that Toxoplasma, this protozoa, can cause multiple ring-enhancing lesions in the brain. Some of the symptoms that this protozoa will cause: seizures, headaches, weakness, numbness, speech or vision problems, depending on where the lesions are located, confusion, personality or memory changes. So, and also just swelling in the brain, meningitis, encephalitis, and also just nausea, vomiting, vision changes from pressure in our brain. So this is just one type of parasite that can cause specific lesions in the brain. And they say that this protozoa is going to be more of a problem in people that are immunosuppressed. And again, another thing is like, why are some of us immune suppressed and others are not? Well, when your microbiome is really out of balance, when you're dealing with dysbiosis, when you have too many disease-causing parasites and not enough health-promoting microbes in your body, your immune system is not able to deal with it. That makes us immune suppressed. So that would be the biggest cause. Of course, if you're on an immunosuppressive drug, that could be the cause also. But for those of us that didn't have a disease before the diagnosis of MS, we weren't on immunosuppressive drugs, but our immune system was compromised because it was dealing with such a heavy load of different types of parasites. The next parasite I wanted to talk about, and make sure that you type your questions in the question box, your comments. I'm just going to pull up the little box there. Awesome. It's so nice to see you guys there. Make sure to share Like, do you have cats in your house? Is there a possibility that you might have been exposed to that protozoa? Or if I talk about some of these others, maybe you eat pork. I know some people like to not overcook their meat. I obviously don't like to overcook meat either, because then it's like leather. But there is this happy balance between, if pork is pink, you may not be killing off the pork tapeworm that's in it. So it's really important that we do cook our meat well enough. So the second parasite is called Taenia solium, which is pork tapeworm. And with a lot of these parasites, like tapeworm, they start in our gut, and then they will lay eggs. Larvae will hatch. The larva will move into different parts of our body, and they will cause cysts. So for tapeworms, they can move into tissue and cause cysts, which is cysticercosis, but they can also move into the central nervous system, and that is called neurocysticercosis. This is well known in science, right? And it's well known that they do have a lesion pattern that they produce, which are single or multiple ring enhanced lesions. Okay, so the pork tapeworm causes lesions when the larvae get into the central nervous system. The symptoms they can cause are seizures. So this type of tapeworm is kind of they feel that it's the most common cause of seizures. Other parasites can cause seizures also, but this seems to be the most common cause of seizures, which would be repeated or chronic. Headaches, chronic and severe headaches it can cause. Also pressure in our brain, that nausea, vomiting, vision issues or vision loss, and also loss of consciousness in severe cases. And then excessive fluid in the brain. Also weakness, numbness, speech difficulty, and vision loss. Some of these things you may have been dealing with years ago, currently, or it's been ongoing. And it's just so interesting how they're so common to different neurological diseases. Gee, I wonder why. Cognitive impairment, memory problems, right? We get the foggy head. We can't remember things. Confusion, personality changes in some people. Movement disorder, so this is tremors, or being like rigidity, involuntary movements. Some of us get those repetitive tremors. Stroke symptoms, and that would be inflammation from blocked blood vessels. Also weakness and pain, sensory loss. So this is all the pork tapeworm. Vision disruptions or disturbances and blindness. So optic neuritis. So this can involve the optic nerve. The most common cause of onset epilepsy in the world is the pork tapeworm. Symptoms and severity, it really depends on where these little cysts end up. Dr. Alan McDonald found tapeworm larvae, so the tapeworm larvae, and also developing juvenile tapeworms in the central nervous system of MS subjects that he examined. So these were people that had multiple sclerosis, they died, their remains were kept saved in brain banks for research. He requested access to them. He looked at it, and I believe in every case he found not the developing worms, but the little cysts, the larvae. And then just in 2 out of 10, he found actual worms that were starting to grow in the brains of multiple sclerosis patients. Pretty crazy. So that is one type of parasite that has been documented in multiple sclerosis, and we know it causes lesions. And the other ones cause lesions. They may not have been documented in MS. Especially like the toxoplasma, I don't think that one has been identified in multiple sclerosis yet. This next parasite is the protozoa that causes malaria. And this has been documented in multiple sclerosis. I did a really significant talk, and I have my notes. I am so blown away. Last week, I talked about how MS is now considered a vascular disorder. Huge amounts of research coming out in that area, really helping us to understand that, like, why these lesions form from, and I'm not going to go into all the details. You can see that the last 2 weeks, I would say, are really profound about this topic. So last week, talking about all the research coming out showing how MS is actually a vascular disorder, not an autoimmune disorder. The week before that, I talked about multiple sclerosis and this malaria-like protozoa. And the research stems back to the late 1800s, the early 1900s, over 75 studies done on this topic. And back in the early 1900s, they were actually treating people for malaria, and they were noticing people that had MS had great improvements. Then some of these very forward-thinking practitioners back then thought, I wonder what would happen if we just carried on treating MS with malaria drugs, and they started looking for malaria parasites, and it's really hard to find them in the brain, but they found them in the brain. They found antibodies to malaria. They also started treating them with quinine, and they were having amazing successes. And then all that research was dropped, and we decided to adopt an autoimmune theory for multiple sclerosis, which we have been following for decades, and we haven't made any advancement. So those doctors over 100 years ago, like getting closer to 140 to 150 years ago, they knew more about MS. They were having better results with treating MS than we do with these newer disease-modifying immunosuppressive drugs. It's so sad, and this is why I do this work. This is why I do this research. I'm trying to show you that you can look up these studies yourself. Maybe you're not a science buff. You can always just look to see that there is a study. You can read the little introductory paragraph, which is an abstract. You can get kind of like Cole's notes of the whole study there. And you can see that this research is available to anybody. Why is it that the experts are not reviewing this? I thought they're supposed to be keeping up with this. Why are they not reviewing this? That's a good question to ask them. Just hand it to them and say, look at this. Why do you not know this? Why are you guys not researching this? It's their responsibility if they are the experts, if they are the ones that are dictating how MS is diagnosed and treated. It is their moral duty to be researching, and yeah, it's work. What do you think? Like for me, all the research I've done, it is work. But at the end of my life, I have a clean conscience that I'm like, okay, I knew that these were infections. I didn't know how far we would get with understanding. By the grace of God, we are this far, and it is so incredibly exciting. I think we're really close to finding the main culprits, and what I'm saying, the exciting part is the science is backing that up. So it's not just, oh, this is what happens in our students when they treat parasites, they recover, but it's like the science is backing this up also. So Plasmodium, this parasite, this protozoa from like a malaria-like, and it's a malaria-like protozoa. It could be a different species. We don't know because they've never tested. They're not looking for it. They don't find any value in looking for infections, which is so bizarre to me. So the lesion pattern is called diffuse or focal central nervous system lesions. And they also see microhemorrhages, demyelinating areas in cerebral malaria. So when this parasite gets into the brain, they do find demyelinating areas. There's a lot of similarities between MS. Like this is probably the front runner of the protozoa that would impact multiple sclerosis or be causing MS. So symptoms, there are many different types of symptoms. I'm not going to go into the unconsciousness. That would be like extreme cerebral. We kind of would have more of a chronic state in our body. So this would be seizures that they cause, confusion, delirium also, and headaches, fever, weakness, vision loss, speech difficulty, if specific regions of the brain are involved or the central nervous system, behavioral changes, personality disturbance or disruption, depending again what part of the brain, neck stiffness, and movement disorders. So we have where our eyes will it's called myoclonus. I think that's how you pronounce it. It's where your eyes move when they shouldn't. Tremors, ataxia. They can all emerge during this infection of cerebral malaria, where this protozoa is in the brain, in the central nervous system. visual disturbances, retinopathy, sometimes blindness or hallucinations. Also, increased pressure in the brain edema. So again, with inflammation, we get this swelling in the brain. And so vomiting, and also worst case scenario could be a loss of consciousness. And then post-malaria neurological symptoms, they can be like coordination problems, confusion, seizures, weakness after initial recovery. So what happens is if our immune system doesn't totally clear it, then it can be in a chronic state in our body. And so for some people, they have really acute malaria. And for other people, we can have these chronic silent infections that our practitioners can't pick up. And so then in time, they move into the central nervous system and they can cause even more of these neurological symptoms that I just shared with you. So memory problems, attention deficits, developmental delays, psychiatric symptoms, which is crazy. So like some of these amazing doctors knew that over 200 years ago, they knew that mental health issues are stemming from the gut, are stemming from the microbes that live in the gut, which is crazy. So severe central nervous system effects of cerebral malaria, they can mimic multiple sclerosis lesions, which is crazy. I think there's one or two more. So nematodes, roundworms, we see this in multiple sclerosis, absolutely. Actually, we don't see these ones. We see large roundworms. We can't see the filarial worms. They're very small. But this has been documented by Dr. Alan McDonald. I share this on a lot of my videos. So for over 100 years, veterinarians have known that when these small roundworms get into the central nervous system of domestic animals, that would be horses, cows, sheep, dogs, cats, they have symptoms identical to multiple sclerosis. They've known this for, again, over 100 years. The veterinarians have known this. I actually watched a video of a surgery, and I believe it was on a sheep or goat, where they opened up the brain. They took this little bladder out of the brain, and they closed up the brain, and so that had more to do with the neurocysticercosis, those little bladders of the immature tapeworm. And then the animal no longer had MS symptoms. It totally went back to normal strength, no paralysis, no numbness, no balance issues, no fatigue. All the symptoms were gone, and it just started eating. Incredible. So with these small filarial worms, Dr. Alan McDonald found them in every single MS subject that he tested, not in one or two of them, but in every single one. And they also carry Borrelia, which is the bacteria that causes Lyme disease. So they're making their own damage as they're scooting around in our central nervous system, but they also are infecting us with Borrelia, and that is heavily linked with multiple sclerosis also, the bacteria that causes Lyme disease. So these little filarial worms would be transmitted through biting insects, yes, ticks, but also mosquitoes and contaminated soil, animal feces, and especially the insect bites, for sure. The lesion pattern are caused by these filarial worms, migratory injury tracts, and also granulomas, which are like little clusters of white blood cells, and white matter lesions. So these are the types of lesions that this type of worm, these very small, they're about the size of the dot of a pen. So if you put your pen and you just touched it on the paper and you saw this tiny little speck, that's how small they are. So they cause like all the MS lesions. I've talked about it before, where there's numbness, paralysis, balance issues, fatigue, all of that, spasticity, all of it, cognitive issues, headaches, all the movement disorders. So they're not just present in multiple sclerosis, but they are present in multiple sclerosis and other diseases. So these lesions and symptoms, they really can resemble multiple sclerosis immensely, and they are present in multiple sclerosis. Why hasn't anyone disproven Dr. Alan McDonald? How hard would it be for another researcher to get some of those samples from the brain banks, even use the same samples? I'm sure that he was just given a small sample of it. And then why can't they look and prove him or disprove? Why is nobody interested in this? Like, I don't even know what to say. Like, why? I don't get it. The next one I wanted to share with you is called schistosoma species. So these are blood flukes. If you are like where we live, we have these beautiful freshwater lakes. And when our kids can go swimming, they can pick up swimmer's itch. And that is actually a blood fluke. I didn't know that when my kids were younger. I thought it was just a bacterial infection from the geese. But no, it's even in British Columbia, Canada, in our fresh water. And the problem is when you get a really bad case of this swimmer's itch and these flukes, they stick onto your skin. They can dig in down through the skin, and then they can go into your bloodstream. And if your immune system is really strong and you're not really out of balance, it might clear all of them. But if it doesn't, and some get past your immune system, then they start to reproduce and grow and multiply in your body. And then down the road, you end up with schistosomiasis, which can cause a lot of problems. So they penetrate our skin, and they largely come through fresh water. Nobody talks about this. I don't even know what to say. Sorry, but it's just so frustrating. I do this every week, but that's why I'm trying to bring change. And what you guys can do, if you find this helpful, like with the things that are going on in the world right now, I don't think we have many years to get this message out. We have to get it out as quickly as possible. So if you want to help me, like, share, and subscribe. It really helps the algorithms to make other people see this work. Share this with groups. Share this with integrative practitioners. Or even if you have a neurologist or a general practitioner that's interested in parasites, if they're not interested, don't subject yourself to a lot of negativity. But if they are interested, share. Like the blog posts, share the videos, everything. That's how we're going to bring change. We're going to educate the general public about parasites. We are going to share this with different practitioners so they can actually help their patients better. We're going to train up other coaches so that they can also really make a difference, because right now the coaching programs are quite pathetic in my view. When I've looked at the curriculum, what they're learning, they are not equipped to help their clients. It's really awful. So the symptoms that these flukes, blood flukes or schistosome species, they cause seizures. Have you noticed that a few of them can cause seizures? It's not just one type. Maybe the pork tapeworm has been shown to cause most of them, but many of these parasites, it depends where these parasites are located in the central nervous system, which nerves they are inflaming. So headaches, delirium, confusion, loss of consciousness in severe cases, altered mental state, visual disruption, so blurred vision, visual field defects, and then speech difficulties, ataxia, so like impaired coordination, weakness, numbness, paralysis. Tumor-like lesions can produce increased pressure in the brain. Again, the nausea, the vomiting, vision changes, so cognitive impairment, crazy. And so spinal cord, where the schistosome species, the blood fluke, I think it's usually the larvae that get into the central nervous system. They can cause acute transverse myelitis. They're also known with loss of motor function and sensation in legs. Also, bladder and bowel problems are really like schistosomiasis is the most common cause of bladder issues. Tingling, numbness, burning, also paralysis and leg weakness, urinary issues, and variable sensory loss. So they're not looking for these flukes in the central nervous system. They're not even looking for flukes inside of us. They just think, oh, well, if you go to the lake and you have all these big welts on you, then, your body's probably going to clear it off. They might give you some little, I'm not sure what they give, but it's not effective. I don't even know if they just know it's like a blood parasite. I don't even know if they know that it's a fluke. And even with like the other flukes that our students have, the intestinal flukes, the liver flukes, you can't even find pictures, like real pictures of flukes online. Very, very few. There could be some animated, like drawn pictures, but very few And so many people that are sick have flukes, whether it's these blood flukes or liver flukes or intestinal flukes. The liver and intestinal flukes are bigger. There's pancreatic flukes or pancreas flukes. There are so many different types of flukes. They are so pro-inflammatory. They cause so many strong neurological symptoms. They're linked with cancer, and yet we don't talk about them. You can't find pictures of them. You don't even know that they're in your country. You don't know that they're in your water. And what happens when you're swimming in your lakes and you accidentally take a few mouthfuls? You're not just swallowing bacteria, but you can be swallowing all kinds of other parasites. The last one, I don't know how common this one is in some of the developed countries, but it's the protozoa that causes sleeping sickness, and it's Chagas. So this is through biting insects also. And this causes inflammation in the central nervous system, multifocal lesions, and meningoencephalitis. So the symptoms are confusion, disrupted sleep cycle, personality and behavioral disorders. So just think about all the people that have bipolar, schizophrenia, depression, anxiety, the children that have learning and behavioral disorders. How much of this is caused by a disruption in their microbiome, by specific parasites that are populated? I think that it is more common. Story. I have horses. So this is like a new adventure for me. I have a 17-year-old mare, and we bred her, and we have a colt now. He's he's 5 months old now. And before I dewormed him, and like puppies and all kinds of young animals, they usually tend to have a lot more parasites. So we do deworm our adult mares too. But I've never had a colt, and he's a male, and I'm thinking, okay, so it's just a typical male, like wanting to nibble, and just like hyperactive, and just almost like a little dangerous and difficult to train. And then I dewormed him, and I gave him 1 dose of ivermectin for his weight, and he passed probably 40 roundworms at least. And literally within 2 or 3 days, his personality changed 100. He's like a mature horse now. He's calm. You go up to him, you pet him. He doesn't bite at all. He doesn't nibble. And he didn't bite before, like an aggressive, mean bite. He was just like, always had to have something in his mouth, and he's calm. It's just, and then now again, a month later, I'm hitting him again because he has so many worms. You've got to treat a few times. And he's passing some more roundworms, and he's so friendly, and he's so calm. It blew my mind, and my husband too. It's like the only thing we did differently was we dewormed him, and he passed all those worms. And we know that these worms can cause in our gut. So we're talking about the central nervous system today, but they can produce so many different substances that affect our brain, like morphine-like substances, amphetamines, all kinds of things that cause learning and behavioral disorders in kids. And this can be why it's linked so much to the schizophrenia, bipolar disorder. Like, it's absolutely wild. It's a different horse. And then can you imagine if we treated children that had worms, and would they still have the learning and behavioral disorders? And some of the behavioral disorders are so bad, especially when they get to be teenagers, if they haven't been treated well. If their microbiome is, of course, there's also multifaceted factors involved, but the microbiome has such a huge impact on everything inside of us. How we digest our food. They make vitamins, the healthy microbes make vitamins for us. They produce antibiotics to keep parasites under control. They act as our natural defense. Many of us were on antibiotics at some point in our life, and that disrupts that healthy ecosystem that we had. And then we are just sitting ducks for whatever parasites we come in contact. And even my little horse, he never had antibiotics, and he had all these worms. Probably from I don't know, he was at a different facility where they breed horses maybe, but I've been deworming his mom. Maybe we're not deworming the adult horses, our pets, our dogs well enough either. 1 dose for our dogs? I don't think so, because as humans, we are doing multiple treatment cycles, and people are passing hundreds of worms when they're recovering from chronic disease. It's very common to have students to say, I've already counted 200, 300, 400, 500, 600 worms. And then you think, how can they still be alive? And again, we're talking about worms, but these protozoa, the smaller ones, and bacteria, they also cause problems. They can even cause these lesions we were talking about. So the last one I'm sharing is this Hydatid, hopefully I pronounced it correctly, Hydatid tapeworm. So this is again a flatworm. So tapeworms and flukes are flatworms. And so we get this through ingesting eggs from dogs. And then sometimes it's even from coyotes going into dogs. And then because dogs eat different feces. And if you're living in an area like a province or a state where you're on farmland and your dogs have access to, there might be feces from coyotes, they can pick it up from that also. And also from contaminated food and contaminated water. The lesion pattern would be expanding cystic lesions. And then the symptoms include signs of increased pressure in the brain, the headaches, the vomiting, the vision problems, seizures, weakness, sensory loss, and cognitive impairment, visual impairment. So optic neuritis also, the optic nerve can be affected. And many of these symptoms for this specific type of tapeworm, they can mimic brain tumors. So, and they're not, when they're finding brain tumors, they're not looking to see what parasite could be causing this. They're just like, oh, this tumor is there. We don't know why. We'll just take it out, right? I don't know. It's just really frustrating. So MRIs are the best tools to evaluate central nervous system parasite lesions at this time. What would be helpful is if practitioners, if they are doing a lumbar puncture, if they would actually allow the spinal fluid to be tested for various parasites. And again, our tests are really poor. If they send it into a lab, nothing will probably show because they're not even looking the right way for things. It would be better like with Dr. Alan McDonald, who's a pathologist, and he just examined it himself using specific staining methods. And so it wasn't hard for him to find these filarial worms, the tapeworm larva, the Borrelia, in the central nervous system. It didn't cost millions and millions of dollars. It doesn't have to cost that, but for some reason, nobody's interested in following up with all this research, all of the science, all of the findings. It's just being left. But I don't think they can hold this in place for too many more years longer because there's more and more people that are becoming aware and talking about it. So these parasites, a lot of them are going to start in either the gut, and then sometimes it's the immature forms that move into the blood and move into the central nervous system. Sometimes we just are bit by biting insects and we pick up the larva from the biting insects and they scoot into the nervous system across the blood-brain barrier. So I'm going to go to your questions. Hello, you're in northern BC. Awesome, so great. And that is Talise Dars. Hi, Pam, a different Pam. Southeastern Wisconsin. It's so neat that you guys we have people from all over the world that listen to these calls. Jimbo, doing an awesome job. Many blessings. Thank you so much. I really hope that this blesses you, Jimbo, because this is the answer. And it doesn't, I'm talking about MS today, but it's every autoimmune disease, every chronic disease, cancer, heart disease, they're all inflammatory diseases. The immune system is fighting something in all these diseases. The primary job of our immune system is to protect us from invaders. And that would include the parasites, the microbes that cause disease, that we know cause disease, and also the toxins they produce. So that's what the inflammation is caused by. And I had another discussion with somebody today about viruses. Viruses are not living. They do not need food. So if we're dealing with a viral infection that's causing our disease, then diet isn't going to make any difference because viruses don't need food. They literally get into our body. There's a lot of question about viruses, but the current understanding is that they get into the body, they get into this cell, and move themselves into the nucleus of the cell. They get the cell to make new viral particles, so they don't need food. And then the cell bursts and it releases all these new viral particles. That's how it can increase so quickly. But there's such little evidence. I know that they're trying to pin it on viruses for MS. I did a talk. You can do a Google search, live disease free, and I think EBV, Epstein-Barr virus, and you can see my notes and the shortened video, and you can see how poorly done or weak their evidence is. It's so incredibly weak. They would like to create vaccines for the virus, right? And that's what they're looking for. But if over 95% of the general population tests positive for EBV, Epstein-Barr virus, it's probably not an MS thing, right? If it was really only characteristic to MS, yes. But if the vast majority of people have been exposed to it and have encountered it and they're positive for it, then we should see that way more people have multiple sclerosis if it is causing MS. And viruses don't eat food. They don't need nutrition. So we wouldn't see such dramatic changes when we change our diet. But that is true for worms and fungus, bacteria, and protozoa. Their favorite source of energy is carbohydrates and simple sugars. So yes, when we decrease carbs and we notice they're less active and we have a lot of symptom improvements, that would make sense. So Pam, your functional medicine doctor found reactive Epstein-Barr virus, Lyme co-infections after CVD 5+ years ago. So the Lyme co-infections absolutely is really common in MS and other neurological conditions. It is part of the dysbiosis we're dealing with. It's very common. But if you just focus on Borrelia, Babesia, Bartonella, treating those infections, which are very small, and you do have large worms and you don't treat them first, you don't treat all of it, then you will never clear the Lyme. Those little filarial worms, they carry Borrelia. So if you just focus on trying to treat Borrelia with antibiotics, number one, antibiotics don't work for chronic Lyme well at all. They really don't penetrate into the deep tissue where the Lyme lives and also the central nervous system, but you'll keep getting reinfected by the filarial worms. And also you'll still have a lot of symptoms because the flukes, the roundworms and the tapeworms, they still cause a lot of symptoms. So we treat from big to small. That's what's really important. Let's see here. Clarissa, you had CIS for 4 years, one flare 4 years ago with only one lesion with 16 bands, but no protein to show you have leaky blood-brain barrier. Thoughts? So what I would do is I would just really start to research this, like watch my masterclass training and go on to livediseasefree.com, and I have an amazing blog. So you just have to know that honestly, like, they picked up a lesion. It's pretty difficult to tell if things are like, look at the research. Go to my last blog post, the vascular disorder, and that's for MS, but there are many other conditions where it's a compromised. I think it's fairly hard for them to pick all of that up. So that no protein to show you have leaky blood-brain barrier. I don't know that that's the only way to test for leaky blood-brain barrier. I would think that they're looking at the compromised, the blood vessel dysfunction. So, and then also this lesion that you had, was there a blood vessel in the center of it? Because a lot of, especially for MS, and I'm sure other conditions too, so when I was talking about some of these larvae of even the worms, so we talked about the malaria parasite causing all of this, but then like the more I do digging, I see that, these tapeworm larvae or these little worm larvae, they also like to live, crossing the blood-brain barrier and getting into the central nervous system, but they like to live close to a blood vessel because it feeds them. So honestly, I would think that the test you had done, I would question it. I would do a little bit more research, because I'm sure that that is not necessarily the case, because how else does the critters that cause the lesion, how else do they get into your brain? They get in through your blood-brain barrier. So that just means that there's damage to a blood vessel, and that could have happened a while ago. It might not be just, maybe you don't have an active lesion, maybe you have more of a chronic, more silent lesion, but the parasites can't get into your brain. There's very specific ways they get into your brain. There's a very specific blood-brain barrier, and that is literally the lining of blood vessels, and that's what becomes compromised. Otherwise, how do they get in there, right? Your immune system does not attack your brain tissue for no reason. That is like total foolishness. It's never been proven, and it's an insult to God's creation. It really is. It's true that chronic parasites can cause immune dysfunction. For example, we can have parasites and the immune system might not even see them. They can release substances and do certain things that will make themselves blind to the immune system. But just that a healthy immune system attacks your healthy nerve tissue for no reason is total foolishness. It has only been good for this autoimmune theory that we have been carrying on for decades. You're very, very welcome. Thank you for all your kind words. It means a lot to me. And I really hope that you share this with other people, with groups, with practitioners. Like, time is of the essence. If we do not start to work hard for a wonderful integrative healthcare, we are going to lose it, especially in countries like Canada. We're moving pretty fast, quickly towards like absolutely no option for integrative health here. So you are here because of ALS. It's the same thing. ALS has chronic infections in the central nervous system, also the gut. So for all of us that have neurological disorders, it is the biggest base camp of the infection is in the gut. They move out of the gut. Some of them, they move in your blood. They move into the central nervous system. So for ALS, that would be also included in all of this that I'm sharing. So Clarissa, you have 2 cats now. I had 2 cats, now 1 cat. You've been cleaning the litter box, for years. And so you can get the toxoplasmosis. You can get all kinds of things. You can get Bartonella from cats. Cats do carry a lot of infections. I know that they're part of the family and that they're your kitty, but you have to be aware that they do carry a lot of infections. So you have to be really careful and really wise. So Tara, how do we get rid of these infections? So what you should do if you want to learn more, because they are challenging to treat. If it was as simple as to take a parasite drug and cure everyone, I would have written a book, and I've got lots of other things that I could do. But when we have chronic disease, a disease label, we are infested. So these worms can lay 200,000 eggs in a day. And so it's really important that you have a very strategic plan. So this is where you support the body first. You decrease food to the parasites. You support the body so that you're feeling a lot better. Then we get energy tested to see which of the parasite drugs and herbs are most helpful. And then we build a treatment plan based on that. And then also our students are using an oxidizing enema. So they're passing worms. So we see what they're passing, whether they're big roundworms, small roundworms, if they're tapeworms, if they're flukes. That's another really huge piece. So we have 6 criteria that we use to help our students to build a treatment plan based on their health history, the health history of their parents, their symptoms, their diagnosis, their energy test results, and whichever types of parasites they're passing. So then we help build a plan. So the person has been energy tested to see which parasite tests well for them. And because we don't have good parasite tests, so we have to, instead of trying to figure out which parasites we have, we find through integrated practitioners which of the parasite treatments test the best for us. So if it's a bunch of 2 or 3 parasite drugs that treat roundworms, and we test well for them, then we probably have roundworms. And then we can also see what we're passing. So then when we start treating, our students will do multiple treatment cycles. If they are newly diagnosed or pre-diagnosed, but they're starting to get significant symptoms, they might do 4 to 6 treatment cycles. If they have been really sick for years, disabled, they might do a year to a year and a half of treatment cycles. But every treatment cycle, when they're using the right treatments, they are feeling better and better. And so for people that are newly diagnosed or they're still functioning highly, you could even be feeling completely symptom-free in 3 months, but you still want to treat until you're no longer passing the worms, until you've been no longer passing worms and also having no symptoms for at least a couple months and 3 months. And then it's really important not to just go, I'm cured, because you're not. You have knocked them back so much in the body that you feel better than you can ever remember feeling. But then instead of treating monthly, you might treat in 2 months, and then you might treat 3 months later, right? So like you're adding the time between treatments, you're building that out, but you will still want to treat at least once or twice a year, possibly 3 times a year. But when you're well, and then you pay attention, like, are there changes in my mood? Are there changes in my sleep pattern? Do I wake up at night? Do I have insomnia? Do I have gut issues? Do I have less energy? I just can't run up the stairs. I'm just exhausted. So all those little warning signs, if we would have corrected them early on, we would never end up with chronic disease, but we didn't know what they meant. We let the parasites become more and more populated. We had bigger and bigger symptoms, and there comes a point where the immune system is like, I'm sorry, I can't deal with it anymore. I can't control this craziness in here. And so then we get these flares of disease symptoms. We get a disease diagnosis. And so we really need to reverse that, but we have to use strategy. And our students test well for 3 to 5 parasite drugs at a time. They're not a magic cure. So all these poor people that are just winging it with 2 or 3 parasite drugs like ivermectin and fenbendazole, they're just trying these things. They're not getting better. I mean, there's a small number of people that like fenbendazole might cure a specific type of cancer, but for people with MS or the vast majority of people that have chronic disease, just like ivermectin is not the main treatment. And it's really like, what parasites were you exposed to? What are you dealing with? Because ivermectin will only treat specific parasites, not all of them. So it's really important to have a tailored treatment plan, to use effective treatments, not suboptimal doses. Otherwise, you can make the parasites resistant to these treatments, and then you can't use them in the future. And if you use too much, you can make yourself very sick. So you only want to use what you need in the right dosages over multiple cycles, treating big to small. And it's like a weedy garden. You've got different types of parasites. You will be knocking back worms, protozoa, fungi, and bacteria. And then go back and cycle through and cycle through. And as you're clearing them, you will feel better than you have felt. That many people can't remember feeling this good because they've been sick for years. So you have been so depressed. You sound like you're going to be my lifesaver. Yes. So make sure to check out my masterclass training. Watch it. It talks about some of the really common symptom or parasites in MS and other neurological diseases. We've worked with students that have PLS, ALS, Parkinson's. We work with the most infested people. That is what God's put on our heart. That was my history with multiple sclerosis. Luckily, I caught it early enough, but that is who we work with. And it is work. It is not like, oh, we have the magic pill cure. No, it is really laying the foundation so that you're going to tolerate the treatments using a very strategic plan tailored to you and going through multiple cycles and then doing your part as far as, taking back your mobility when you start feeling better, exercising as you can, building a healthy lifestyle. All of that is important, but you can't get better unless you treat the parasites. They're what's causing your symptoms. You're very, very welcome. So watch the masterclass. If you feel that this is a good fit for you, then you can fill out the form. And then if you want to chat with me, that would be fine. but just watch the coachathon also, because the coachathon gives a lot more explanation for all the steps we take in the academy so that you really understand the process. You're very welcome. Just a couple more here and then we'll wrap it up. So in 1994, the case definition of Lyme disease was purposely changed. Yes, narrowed down to make it look like profitable vax was safe and effective. So the whole Lyme issue, yes, Dr. Richard Horowitz, I have his book. I think he's wonderful. And it is very important to treat Borrelia, Babesia, but you can't get well if you only treat them, because you have to also treat the other types of parasites, which are way bigger. Like a worm is many, many, many times larger than a bacteria, and they can cause a lot of symptoms. So even the filarial worms are many times bigger than bacteria. So it really is important to address all of it. How detox from them, especially respectively, who cares what they are called? Well, it is important to know which parasites you're dealing with, Tara, because different parasites require different types of treatments. They're not like some that will treat Borrelia are not going to treat filarial worms, and some that are treating, although there is some overlap, but you can't recover from these really large parasites with just the herbs alone. At this time, we haven't been able to. So there is RMN lab again, but you can be tested by these labs for the Lyme infections and they still may not show. They're not 100% accurate. And I've actually done that test before, and it was I think it was at least $600, and I know it was not accurate. Yes, Dr. Alan McDonald is an amazing hero, and he does warn about biofilms and Babesia. He's really a Borrelia expert. Okay, I'm going to let you guys go. Just keep typing your questions in. We will answer your questions. Nicotine patches, it's something that you can try. For some people, it helps to manage their symptoms, and for other people, they could feel worse on it. It's not going to treat the parasites. There will be some nicotine that's delivered through your skin, but it's not going to be, I think that nicotine is also anti-parasitic properties, but it won't be enough to treat the parasites you're dealing with. All right, I'm going to let you guys go, but please, if you enjoy what I'm sharing with you, make sure to like, share, and subscribe. Share this with people, with groups, with people you know, with the MS Society, with any practitioner. It could even be a functional medicine, nurse practitioner, general practitioner, naturopathic. It could be different groups, MS groups, or other groups. But let's get the discussion going. Some people can be negative. That's totally fine. What's really important is that we start talking about this and we start bringing the research out. We start bringing the truth out so that our healthcare system can make a pivot and can start to talk about looking for a cure again. I think recovery is a more accurate word, because the parasite drugs don't cure us of these parasites. They really decrease the presence of these parasites in our body to the point where we feel amazing. But again, you can have eggs and larvae, and again, hiding under biofilms. So it's about recovery. It's about feeling amazing, going back to a time where you used to feel like your old self, getting on with your life, and then learning how to manage the microbes that live in your body for the rest of your life. So I've got, again, lots of wonderful information on livediseasefree.com. Under the blog post, we've got our diet, also the guidelines under research, the main menu on livediseasefree.com. Watch testimonies from our students that have taken the program. You will cry, happy tears when you see them. They're on YouTube. They're also on our website. And then when you get to that place, it's like, Pam, I know that I have parasites. It makes so much sense. I've done so many things. This is the only thing that I have not done. And it's painful that I didn't do it because I've wasted so much time and money. I'm ready, but I don't have a practitioner that can help me. So that's what we do, is we help you to make sure to be ready to treat, make sure that you are going to be accessing the correct treatments and practitioners, all of that. That's what we do for people all over the world. This is our mission, our ministry, our work, and we would be honored to support you if you would like our help. So then watch the masterclass training, fill out the form, look for an email from us, then also watch the coach-a-thon so you know really clearly what we're doing, and then you can book a time to chat with me, and I would be honored to make sure it's a good fit for you. So with that, I'm going to let you go. Hope you have a wonderful week. Talk to you next week. Take care and bye-bye for now.